Look, this seems incredibly mean-spirited, and the timing of this, terrible.
Yeah, the optics don't look good. A very good morning to you, Isabel. Essentially what the government is saying, they announced these plans last August. They then opened it to consultation. And effectively what they're saying is, of course, at the moment in England, for Scotland, Wales, Northern Ireland, you don't have to pay for your prescription. But in England, if you're over 60 or if you're a low earner or if you have certain medical conditions, you don't have to pay for your prescription. Now, the government said last August that it is opening a consultation on changing the rules. So if you are, so essentially raising that age limit. So instead of getting free prescriptions when you're 60, you'd have to wait until you're 66. Now, the government says the reason it gave was that because of the rise in state pension to 66, it's created what they are calling a disconnect with age-based prescription exemptions. Now, their preference is to phase in these changes over a number of years. And they're also making the point that a lot of people in their 60s are now working, so they can pay for their prescriptions. Now, it would cost the government, or rather, it would save the government £300 million a year by 2027. That's according to figures from the Department for Health and Social Care. I did the maths roughly on that, £300 million. It's about just under 0.2% of the NHS budget for England. And as you say, the optics of it, coming at a time with rising taxes, rising national insurance contributions, rising inflation, the cost of energy bills soaring. So a very, very small amount of money, but coming at a very bad time. Doesn't look great for the government. They say they haven't made a decision yet, but analysts reckon it could happen as soon as the 1st of April. That's when prescription charge increases happen. They actually have to tweak the law. There are NHS regulations that they have to tweak around about February, March time every year so that they can then put up the cost of prescriptions. So a lot of analysts are forecasting that they'll do that this April. At the same time as increasing prescription charges in line with inflation, they'll also change the age at which you qualify for free prescriptions. But yeah, that remains to be seen whether they're going to do that or not yet. The government said they're thinking about it at the moment.
You know, it's becoming a buzz phrase, isn't it, Paul, the cost of living crisis? But honestly, every day this week we've talked about it coming from a different angle. This morning, on the front of the Telegraph, they're talking about 1 million people being pulled into a higher rate of tax, 40 pence rate of tax bracket over the next 4 years. 1.2 million people could be paying the top rate.
Yeah, this was announced last year in the budget, and essentially it's not a tax rise. The Chancellor could say he hasn't put taxes up, but what he does when he freezes the tax brackets, that is the rate at which you start to pay tax, and then at 40p you start to pay more tax, he's frozen them. So as wages go up, it pulls more people into paying tax. 1.5 million people from April will start to pay any sort of tax, income tax that is, at all, and then 1.2 million will start to pay at the higher rate of tax. So a lot of more people are going to be paying a lot more tax. Great for the government. They get more money so they can spend it on public services. Not so great if you're a low earner, if you're struggling to pay your household bills, if you're struggling to meet your council tax bills as well. They're set to rise. A lot of people are forecasting from May. So yeah, not great timing. The Lib Dems, Labour, they're calling for the government to look at this again. But that's what the plan is at the moment, and it'll come under a lot of scrutiny over the coming months.